Welcome to episode 2 of Juve Talks. This is a podcast that is tailored specifically to entrepreneurs talking about using their platforms as a beacon of social change, adding value to the community as part of their business model. I just want to take the opportunity to say a very warm and heartfelt thank you for the outpouring of love and support that we've received upon the release of our first episode, which has gone viral. We've actually crossed, within the last few days, we've crossed 200,000 views, which is quite spectacular for such a small company that we have. Thank you so much for that. Let's keep the love flowing, all right? So, in today's episode, we feature a dynamic duo. We are talking about medical experts who would be talking specifically about how they turn their medical expertise into a business, a thriving, developing business that has helped so many people. All right, let me introduce to you Dr. Vinoth Kumar and Dr. Bharthi. Welcome. Thank you so much for joining us on the show.
Thank you so much for inviting us.
And to just go a little bit closer into the specialty, so Dr. Vinoth is a cardiologist and Dr. Bharthi is a pediatrician. Let's begin. So in your personal journey, I think many people would look at your clinic with one doctor being a cardiologist and one being a pediatrician. It's a very unique blend of specialties under one roof. So tell us about your individual journeys and what inspired you to become a doctor. What really made you take that decision upon yourself? Let's start with you, Dr. Bharthi.
Yeah. As kids from 90s, it was always like this. Like if you are a good student at school, you were always asked to choose either medicine or engineering. And if you are inclined towards science, it is always medicine is the only choice. Those were not times where we had too many inspirations coming from different areas like social media or other things. Only few doctors who we get to meet, particularly when we are not from a medical family. I'm not from a medical family, either he is. So it's always good students go into medicine. So after we entered medical field, after I started my journey with my MBBS, that's when the inspiration actually started coming in. We get to meet different doctors who are really inspiring. And when we entered my internship, that's when I actually got inspired with pediatrics. So I found myself very comfortable with kids, and I found kids very comfortable with me. And I thought it's a good field to choose.
What about you, Dr. Vinoth?
Yeah, for me, actually, my mother told that you are a good student. As she told that you can choose medicine. That's how I entered MBBS. Before entering into MBBS, I just, because mom told, I chosen, actually, I've chosen. And then after entering into MBBS, when I came to final year, I've seen some of the good doctors, especially my cardiologist. He was very good at that time. And it inspired me to become a cardiologist. So to become a cardiologist after MBBS, you need to do MD General Medicine again 3 years. Again, then you have to do 3 years for cardiology. It's a long journey. But I've decided in the pre-final year MBBS only, I'm going to become a cardiologist actually.
Nice. The thing is, doctors, when you run a clinic, for those of you who don't know, let me just quickly introduce it. Drs Vinoth and Dr. Bharathi, they both have a really wonderful clinic in Nalagandla. So I just wanted to find out at the start of your clinic, because a lot of doctors, the journey tends to be that you finish your medical school, you've done your internships and whatnot, and then you work in like a hospital for a long period of time, or corporate hospital, or many of them aspire to work with the government hospitals. But you guys have started your own clinic. So what was that journey like, and what were some of the high points and low points that you would have faced along the way in establishing that wonderful clinic?
Yeah. For me, like as you said, in the beginning, all of us do work in different places. I did work in few medical colleges, and I worked in a corporate hospital before starting this clinic. Starting this clinic was more like an accident, I would say. I was working comfortably in a corporate hospital during the COVID times, and then COVID hit. We all had a lot of, it was a lot of pressure from the patient side and from the disease perspective, everything. And my kids were not going to school at that time. I had two wonderful kids. They were not going to school at that time. They were studying from home. So I was forced to make a choice where I have to be with them, spend more time with them, as well as I have to keep my profession running. So I decided to start a clinic. And the clinic, I initially started it as like from morning hours only so that I can spend more time with them. Then later we expanded it to more working hours. He was always working in a corporate hospital, like he still works in a corporate hospital.
I just started because being cardiologist, we need a very big setup like infrastructure, which we need a very big corporate hospital, obviously, to do procedures because we do interventional procedure for emergency angioplasties and everything. And initially I was working, but after sometimes I felt some of my patients who were a bit far away, just in my locality to travel the hospital, they will have some apprehension whether I'll be spending more money, or some apprehension was always there actually. And I wanted to, I'm more inclined towards preventive medicine. Always I had an interest to see I can save much more lives in preventing, by preventing the disease, rather than after getting the disease treatment that I save very negligible segment of population. But when I take care of the people in the initial stages, that educate them about diabetes, hypertension and other things, I thought I can do much more, where I can spend more time. So I thought whatever I wanted to do, I mean, I implemented in my clinic. That's why I started my clinic in the as a part time. I started actually in the evening times. So there I have time for my patients. I can educate them what is important, how to prevent disease, basically how to prevent heart attack, what all can be done. So that gives a personal rapport to you and your patient. They feel like I can give space to them. I can talk to them. So without much apprehension, they can spend some time. So that was my vision even during my college days, actually, during my MBBS time. So I felt much more happier when I spent some time with my patients, sitting, talking to them about their diseases and that about prevention. So initially it started with 1 to 2 hours, then slowly it extended. Basically, I started enjoying my work. So that's how it extended actually.
I find it so fascinating when young people, especially with a family, decide to invest in themselves as a business because you have something that you've earned, you've worked so hard to get. So the idea is in setting up your clinic, in taking that big investment, because it's not cheap, you have to pay staff, you have to pay rent, you have to get things ready, your pharmaceuticals and all of these different supporting things for your clinic to function the way it ought to. Was there any moment where you kind of doubted yourself or kind of wondered, what am I really getting into?
Yeah. To start with, I was very apprehensive. As I told you previously, I was working in hospitals. To start with, I was not very confident of how this is going to work out, how this is going to, what is there in the store. So as we started, one thing to be very frank is running a clinic is not like running a big business.
Right.
Yeah, there are supportive things which are needed, but ultimately it is a one-man show.
Okay.
The main person there is the doctor and the patient rapport. So when we are committed, when our intentions are very pure and clear,
correct,
and the show is going to run for sure. The supportive staffs are, of course, very important. Initially, when we started, we had a lot of difficulty getting staffs who are aligned with our intentions.
Correct.
Staffs who are really committed, who are really patient-centered, who don't take this as just a job where you sit and, have you come? Okay, fine, not like that. That commitment and the connect they need to give to the patient who is waiting in the reception. They need to identify who is sick, who is to be, that basic triaging and all those things, they need to be there. They need to be on time.
Yes.
All these things are very important. Initially, we did have a lot of struggle. We kept changing people. And now finally, at least for the past 2-3 years, people are well settled and committed staffs we have who are sincere. And the patient-doctor rapport, it's completely established. And we are also more confident. We went step by step only. It was not like the day one we had all pharmaceuticals, everything ready. We started as a small venture. We had the patients flowing in. We had few staffs to start with, just 2 staffs. And now we have like 5 staffs there and all the pharmaceuticals, laboratory facilities, everything available. It was slow to start with. We learned during the process and now it's everything is settled.
I think that's very important to note as entrepreneurs or people who are kind of thinking about whether to explore that kind of path. It does take a bit of trial and error. It is a bit of a learning curve all the time. But just because we do come across certain challenges, we don't just put the hands up in the air and leave it alone, right? Because you might be sitting on something great. So let's pivot now a little bit into the idea of heart health and parenting balance, especially for people who are entrepreneurs themselves and they have their own families. Unfortunately, Dr. Vinod, I happen to be aware of a lot of heart disease being publicized among entrepreneurs, startups, founders, CEOs, etc. Let's say, for example, that yogurt brand that people love, that Epigamia, I think it is the name of the brand, that CEO, he passed away from cardiac arrest. There are so many other brands that I've read about where the top executives had suffered from coronary diseases. What do you think really is the culprit there? And do you have any kind of advice that would help entrepreneurs, especially at a startup stage where the funds are low, they're always stressed, it's very tense? What kind of advice would you give to people like that so they don't fall into that kind of a situation?
Yeah. So as we know, the recent times we see a lot of news about young heart attacks actually, and it's more about any person to develop a block, they should have some risk factor. So nobody develops block just like that. So the risk factors may be parental history, like family history of heart problem, especially father before the age of 55 or mother before the age of 65 or 2-3 family members having heart problem. Those kids will have more risk for a heart problem at younger age. Maybe they can start at the age of 20 to 30 only. The lifestyle is not good. And second category, overweight, lack of physical activity, poor dietary habits. These are the very, very important and most common reasons what I see nowadays. And apart from that, smoking. So these factors play a major role in development of blocks. So usually blocks develop from the age of 3 to 4 and then slowly it starts from the age of 3 to 4. Slowly very small fatty streaks they start. By the age of 10, 12, based on the kids' lifestyle, they increase. So by the age of 15 to 20, if there is no physical activity, if they follow poor dietary habits and other things and start smoking, so the block develops very fast, and by the age of 25 to 30, they may be having 30 to 40% of block which is undetected. So when they are a person with less than 70% block can do everything. They can climb 10 floors, they can run. So they assume that they are doing good, but it's not the case. So how to find out? You cannot find out by doing all the tests. So best way to prevent it, whenever somebody is having block of less than 70%, they will not have any symptoms. So how to prevent the heart attack? When the block of 70% or 30% ruptures, it results in 100% block. That is called as heart attack. So to have heart attack, somebody should have 100% block. So that 30-40% block should be stabilized. How to be? It has to be stabilized by controlling your diabetes and control your hypertension. For that, you need to check your sugar level, blood pressure level, and cholesterol level. These things should be under good control. And smoking, if at all, if it is there, it has to be stopped. It has to completely, we have to stop smoking. Even 1 or 2 cigarettes, people think that also can harm, that can rupture the block. And good amount of physical activity, at least 30 minutes of physical activity, at least 5 days in a week is a must. Aerobic physical activity in the form of walking or jogging or swimming, anything, 30 minutes of physical activity, at least 5 days in a week, along with 2 times in a week, they can do some muscle strengthening exercises. These things will help in reducing your weight and reducing your blood sugar, blood cholesterol, blood pressure, everything. Slowly those blocks, even if they're there, they'll stabilize. They will not rupture suddenly. So preventing heart attack actually. So, and stress is the most common reason for block rupture. Somebody is having 30-40% block. If that guy undergoes extraordinary physical stress in the form of undergoing some extraordinary physical activity if he is doing without much previous training, or somebody who is having some psychological stress in the form of financial stress or loss of a family member, something like that, this block at the shoulder point is the weakest point where it ruptures, immediately clot formation will form. So within 10 to 15 minutes, the 30% block will become 100% block. So heart is devoid of blood immediately. Then that time patient will have abnormal electrical activity, like heart will beat for 300 times or something like that, heart can rupture, and that results in cardiac arrest actually. That is the most common reason we see in youngsters. So to prevent that, what we are supposed to do, as I already told you, that stop smoking, control your diabetes, hypertension, cholesterol, if at all if it is there, and daily 30 minutes of physical activity, reduce your weight, maintain ideal BMI, and you should take breaks in between your working thing. You should not think that, okay, I'm going to settle and then I'll do my physical activity. I'll do. So there is no postponement. Every day is important. Every day you should spend some time for your health and follow good dietary patterns. Most of the times entrepreneurs, they'll be working outside, so they take them outside food. Most of the times you try to eat more vegetables, more fruits, and less fried items, less oily items. Preferable home food is better. Even if you're far, I mean, whenever possible, you try to take home food. Outside, take more vegetable, more fruits. You can choose what you want to eat actually, because this journey is going to be like this only. Most of the entrepreneurs, they'll be working outside, they'll be away from home for many days. So that time, they think that, okay, I'll set within 2-3 years I'll settle. There is no settlement for anyone. No, life is, it's like a lifelong journey. So you have to think you are the main pillar for that particular brand what you are doing, no, whatever the company you are running. So you have to make sure that you are follow good lifestyle and you are healthy, so that you create a system is to that which is dependent on us, which is going to be sustained for longer time.
Learn something every single day, isn't it? Dr. Bharti, I was just thinking of the fact that when people think of work-life balance, the first thing you think is, I'm working at an MNC, I should be working at a very big company where work-life balance is actually a thing that people think about. When you work for a smaller company, there's no such thing because everybody is busy doing every single thing. How does an entrepreneur who struggles with that work-life balance for themselves, how does that affect their children in the household? And do you feel like there are certain telltale signs that you can identify as a parent that my busy schedule, my stress is actually going and affecting my children?
Absolutely. There's no doubt about it. It definitely affects kids because I always tell my patients also, when you decide to have a child, it's very important you decide to give the right time to them. Otherwise, don't have kids till you settle or till the time you're not able to give that time to them. Very young kids, nowadays it's very common that we find that they don't connect socially. When they come to my clinic also, when I ask them some questions, even adolescents, young children, they don't give that eye contact. Main reason being they grow up at a very young age, when they are just 1 year old, 1.5 years old, with someone like a caregiver in a daycare who is not able to emotionally connect with the child. The caregiver works for money, right? He works, it's not a service or the emotional love or connect that the caregiver from the daycare can give this to this child who is very young. Sometimes I even find 6 months, 4 months old kids going to daycare. See, that is a child who is completely needs, see, if it is not the mother or the father, at least some of the family member who will be able to give the genuine love, not someone who is just working for it as a job.
They need a proper primary caregiver.
If you are not that emotionally connected with an adult at that age, the child, as the child grows, is going to be peer oriented rather than the adult oriented.
Got it.
This peer orientation is going to have a major influence on that child. What an adult can influence on a child, a peer cannot.
Correct.
Peer can give them the joy and the freedom and the freedom to talk anything, discuss, and what is in current affairs and all that. But adult can only inspire the child, because as an adult you have a complete mature mind. For a child of the same age, you cannot give the same mental maturity. See, these kids, I can see the difference between the kids who are like 16, 17 years old and the kids who are like 4, 5 years old now. The social connect is completely lacking. When we talk to them, they look somewhere here, there. They are not able to connect emotionally with us. It's very, very important, particularly one of the parent has to be available with the child at least till they are 2 years of age, till that 80% of the brain development is completed, and at least till 4 years of age, the time they are at home after coming back from school, at least few hours committed emotional that connect has to be established. And pursue your passion also, establish your organization, whatever you're doing or your job, and let it grow, both grow simultaneously. Yeah, that's very important.
Thank you, doctor. I think a lot of parents who are tuning in would find these things quite insightful, because it's very easy to overlook the impact that our behaviors have on our children and the stress that we bring home. So, I mean, for those parents, both of you who are working, what you're doing is admirable. But I think it's very important to just take some time to connect with your child on a very deep and meaningful level. So, let's pivot a little bit to talk about conservative medicine and ethics in the field. Now, we live in a society where I think a lot of people tend to sort of overestimate the fact that even conservative treatments can make wondrous results. And in a world of quick fixes, how do we, as medical experts, feel about just immediately running? You have this symptom, you go and you take a pill for it. How do we feel about that, Dr. Vinod?
Yeah, so conservative treatment, I understand that many people just initial stages of the disease, we can do conservative treatment, but in some emergencies, definitely they need interventions. So there is no clear-cut definition, only these cases can be managed only conservatively. 50% of the diseases during the initial stages, yes, very well they can be managed conservatively, provided the patient understands the watchful signs, warning signs, at which time he should go to hospital. So the doctor is also should be in a position to explain to the patient the clear-cut definition of conservative treatment, till what time they can follow conservative treatment. For example, a patient with a angiogram done, a patient is having some blocks, and the patient can be managed medicine, because if the patient doesn't have any symptoms, we put them on medications. And during the course of the treatment, sometimes if the patient feels unusual breathing difficulty, or sometimes he might be having chest pain or some new symptoms develop, that is a warning sign where he has to meet the doctor, and sometimes that may warrant immediate treatment. If we miss at that particular point of time, so patient may land up in major heart attack. So the initial stages of conservative treatment, the patient should follow the clear guidelines, whatever given the advice given by the doctor, and he should stick on to the medications clearly, and lifestyle changes, dietary patterns, everything if he follows, definitely conservative management is going to work for many diseases. But only thing we should understand it very clearly, the warning signs, when I should report to the doctor, and I should follow all the things provided, all the information. I should not, timely, I should not think that, okay, I'm going to give conservative, I'm not going to get any intervention in the past. We should not be the fixed idea. I'm going to follow conservative medicines. As and when required, definitely I'll go to the doctor. If the symptoms definitely is indicative, I mean, if it's suggestive of some major issue, then probably I might need intervention. That understanding should be there for the patient, and the doctor also should be able to explain the patient very clearly in his local language, so that the patient will understand it in a better way.
And Dr. Bharti, does the same philosophy apply to the field of pediatrics?
Yeah, absolutely, yes. Because, see, let us take the current scenario. We are having a lot of flu, dengue going around in the city. See, in dengue, mostly people fear, okay, once dengue comes, okay, the platelets are going to fall, the child is going to get sick and other things. See, there are certain warning signs in dengue, which I follow in my clinic, as I tell all patients who I suspect dengue when to come back to me. That's the most important thing that I tell them.
Correct.
And I also tell them till when they can wait at home. See, it's very important when we are following conservative treatment, it's very, very important the patient completely understands what we are saying. They should be well aware of, as he said, the warning signs, very, very important. Once they miss that, then the total idea of conservative treatment also fails. We should be able to educate them well, they should understand that properly, and they should be committed to follow that. That is when the conservative treatment succeeds. I can give you an example. The most dengues, I don't admit, like out of 10, there is one child who goes for admission who has the warning signs. 9 out of 10, I call them every day. I check their platelets, I check their clinical signs. But if the patient is not ready to come every day, then the entire thing is going to fail. Then I will be, if I don't have the confidence, like even if I have the slightest doubt that this patient is not going to turn up tomorrow, I'll have to send them for an admission.
Right.
The other day, there was a child who had a severe wheezing. I had advised nebulizations and other things, what they should follow at home and when they should come back. And the next day morning, the child is coming to me with severe breathlessness. when I asked them what happened, what went wrong, because I was very sure if everything was followed, things would have worked out in a different way.
Right.
And the mother said that she was not ready to take nebulization. I did not give her. So the moment I thought the next time I should be telling them, if your child is not taking nebulization, this is not going to, home treatment is not going to work.
Yes.
So I did insist on the point, but if the child is not cooperative, the mother should be aware that,
Yes.
when should she come back? The same day evening, if she had come back and told us, like, see, she's not taking nebulization, then I should be sending the child to
Yes.
admission only. So conservative treatment depends on both the doctor, our commitment, and the advice we give, the time
Yes.
we give to the patient to make them understand, as well as on the patient's side, whether they
Correct.
follow what we say correctly or not.
I think navigating this balance between ethics and medicine can be a bit complex, especially in the Hyderabad environment where you have a proliferation of medical clinics and hospitals, especially with corporate hospitals. They have, I'm not saying all of them is like that, but there is that perception that many people tend to have, wherein, we wonder if I should admit my child or my family member, my loved one, in a corporate hospital for the purposes of making sure that they are treated ethically. So in this particular case, do you feel as a medical expert, as a doctor, having yourself been associated with corporate hospitals in the past and present, how do you feel about your medical ethics, your personal sense of ethics, and trying to benchmark that within Hyderabad as a situation? Do you feel like you felt compelled in any way to kind of have to remind yourself where certain boundaries are? How does it work for you, doctor?
Yeah, actually, ethical wise, most of the doctors, they just want their patient to be all right and what is necessary. So my personal philosophy is, what is best for my patient? Patient is first. That's it. My patient has to recover. What is the best? My mind will be revolving around that. So what investigation I can do? What next medicine I can change? If your thought process and intention is only about the patient's medical condition and its improvement, everything falls line. You don't think about anything else. Your intention should be about, my patient should recover within the resources, whatever the available resources. See, everybody may not be affordable for every treatment. Actually, we come with every patient is different. Actually, so for my patients, based on patient educational status, based on his affordability, I should give the best treatment available wherever. See, I cannot ask all the investigation for a diagnosis. For example, a person from US, in US they will do a set of investigation to diagnose. I cannot apply everything to diagnose for a condition. In India, many times we make a clinical diagnosis, 99% will be right. Only to confirm we do investigations sometimes. So based on the patient's affordability, we just think, okay, this patient needs only these investigations. We'll explain to him. We'll explain the patient, this is what I'm thinking, this is what the diagnosis, you take it for 10 days. If you're not improving, we'll go to the next level of investigation. So that's what we do at every level, step by step approach. And nowadays what happened, because of the Google and all just chat GPT, people on day one, they come with a big list of investigations. So it is very, very challenging for us, and we are put in a different situation. For example, I tell you, there was a patient who had a major heart attack. He was around 38-year-old male, coming with a chest pain, clear cut heart attack. I know that any point of time he might collapse. I did the ECG, just it took hardly 1 minute for me. Just I found out he has to reach hospital. So I'm explaining him. So he was asking me, so based on, how did you diagnose this heart attack? He was asking. I told, based on the ECG. He was explaining me, he was asking me, please explain based on the what finding in this ECG with you suspected. I told him I learned it over 15 years. You are asking me in 15 seconds to explain. I told, there is no time for all these things. You please take this emergency medicine. So ecosprin, clopidogrel, these are the life-saving medicines which has to be taken immediately. I have given all those medicines to take and call his wife. So this guy was doing the Google search of those medicines for what it is used and side effects of those medicines, sitting outside the chamber, not taking the medicine for more than 15 minutes. Every moment was like, because the sudden risk of death is almost 9% for every half an hour delay. So I told him, just please call your wife or one of the family member. He was telling, no, just they are weak people. She is very weak, my wife. She cannot tolerate these things. And he was waiting. He came at 5:30. I was just bargaining with till 7 o'clock. Then I took the number, spoke to his friends at least. I called one of his, please take him to hospital. Finally, the guy left and he did not go to hospital. But I know that if something emergency happens, I have to help him out. No, I've given the hospital number, what to do. midnight 2 o'clock. He reached with a low blood pressure in a very bad shape. I had to rush at 3 o'clock in the morning. It was tense moment for the family. Finally, he survived, but heart damage was more, and it took almost 4 to 5 days, 2 days in ventilator to recover. Actually, I was just thinking, just because of this Googling and Chat GPT, he got so much confused. If he had gone at the correct point of time, it would have been just 1 hour work for me. Next day, I would have discharged him actually. So this education also becomes problem sometimes. That is the thing. There are other group of people where the patient himself, he doesn't have any problem. So he reads in Google about all the complaints of heart attack. He assumes that he has all the symptoms. He comes to me. I do all the basic investigation. I tell him that you don't have any problem. He says, sir, can you guarantee for my next 20 years? I told, I cannot guarantee. Till today, nothing is there. If you follow this good lifestyle, the chances are very less. Again, he comes after 1 week to 10 days with father, and first father comes. And I say that nothing is there. Then father doesn't come. Then wife comes. Then wife doesn't come. Then he brings friends. Finally, nobody wants to come. Finally, he comes alone. Then I tell him that you don't have any problem. No, sir. In the Google, when I Chat GPT, when I put all the things, no, it is telling, it is showing heart attack, and finally it is showing death also. I don't think like that. So we have two group of people who have problem and not believing, people who don't have problem and assuming that. That is the most horrible thing, because the wife doesn't know that husband is, she doesn't know, no. Every time he says the chest pain, she brings to hospital, she's thinking what will going to happen. I tell them, don't worry, nothing will happen because of the pain. He will not collapse. In case if at all something has to happen, it's happened for you only. Don't worry, nothing will happen. So like that, I have to tell them. So that's how it has become, that because of extra unnecessary information, they are putting their lives at risk. See, for me, it's like one extra stress, but for the patient, it is his life. So they have to trust at someone, whomever they trust, the doctor. If you don't trust one doctor, you can go to another one, very well. But you cannot put your life at risk. That golden time is very important. In heart attack, every 30 minutes it matters actually. So once you diagnose, you have to treat them.
There is always information and then there is misinformation. Yes. And I think we live in this digital age where everything is just a Google search away, a Chat GPT prompt away. So Dr. Bharti, in terms of for minors, especially when the parents, I mean, it comes from a place of concern, but it doesn't necessarily, as you're saying, Dr. Vinoth, it doesn't diagnose the patient, right? This is not a medical thing. So what I'm saying is, how do you as the Dr. Bharti, especially in the case of minors, have a very kind of a difficult conversation where you need to kind of tell parents to kind of cut this off and, you know, shape up and get your act together. There are certain changes that have to be done. This is what you have to do. Please desist from doing all of this, you know, noise making with the Google search and is this right, is this wrong? Where do you draw that line with your patients?
Many other times it is very easy when the patient is your regular patient. You have a rapport with them.
Yes.
We had already established a rapport and you know very well about the child's upbringing, the child's general behavioral patterns and other things. Suppose the child is new to us, it's the first time patient. It is little difficult to, you know, to say certain things with certainty, with, you
yes.
know, and many times it's difficult for them also to take a completely different advice from what they were believing and how they were parenting their child from a new person. Yeah, that is little difficult. I always tell one thing to all my patients: be mindful of what you're doing. Okay. Be mindful of what you're doing. Like very simple things. There are many parents who don't give junk food to their kids,
yes.
but they themselves love junk food.
Yes.
They sneak out to eat at night,
yes.
you know, but they say don't eat ice cream. They
yes.
sneak out at night to eat ice cream. That's never going to work out.
Right.
What you believe, you are committed and you are doing is what your child will do, not that what you say.
Correct.
It's very, very important. So it's absolutely important to become the person how you want your child to grow up to be first before you tell your child. The basic health advice that I give to most of my parents, kids, are eat right, sleep right, move right. Physical activity, right healthy food, most of the days home cooked food. Even if you eat a pizza, if you make it at home, it's going to be completely different health wise than the pizza you eat out. So eat the right food, mostly homemade food. Move rightly, do the physical activities properly and sleep right. Most kids nowadays, parents sleep at 12, 1
Yes.
o'clock due to their work pressure, and kids sleep same time, 12 o'clock, 1 o'clock. Morning they need to go to school, and what kind of concentration they can have at
Yes.
school. So sleeping, take the time to take break from your work, go put your child to sleep, and maybe then continue your work. So these things, it's very, very important too. And difficult conversations, as you had, it's mostly with adolescents is what we have. When we have to tell an adolescent that what you're doing is not so right for your health, which their parents are already doing, and the adolescent is frustrated about it. When I'm also going to go and tell the same thing, I need to put it in a different way. First thing, I need to earn the confidence of that adolescent.
Yes.
I need to first tell the adolescent that yes, we had also gone through this. I also have kids at home who do the same things. It's not something abnormal that you're doing, but it's not the right thing to do. First
Right.
we normalize, first we make it a common thing. Yes, it is very common, but it is not right. So I need to first earn the confidence of the adolescent before I put any conversation with them. First, particularly when it comes to body shaming, when it comes to bullying. See, these are the common things that we face nowadays. We are not dealing with much of typhoids and chicken pox and
Yes.
stuff nowadays. It's more of adolescents, mostly it is psychological problems that we are dealing with. Bullying, body shaming, and personality image related issues, and their addiction to social media.
Yes.
And their addiction to whole lot of things. The way they want others to look at themselves, the way they perceive themselves, the way they perceive their emotions. These are the things which are difficult to talk to with my patients.
Wow.
It's very easy to deal with infections and stuff. I wouldn't say it's very easy. It's rather it is well formed. We have guidelines. It is well
Yes.
formed, well established. It's easier for us to understand the symptoms. It's easier to put it in words. It's easier to show us evidences. But these are the things which I find a little difficult to deal with.
Let's talk a little bit about the balancing between heart and mind. I think some studies that I was reading suggest that toddlers tend to have like about no less than 20 tantrums in a week. So in balancing, understanding that the tantrums come from their mental, psychological, whatever the situation is there, how does that impact the physical treatments that you would be giving to a child that comes to your clinic, doctor?
Yes, that definitely does impact. Say, for example, just a tantrum they throw to, say, the other example that I gave, the child was not ready to take the nebulization.
Right.
So how do I, make that child accept that nebulization? It involves a lot of parental involvement. A very simple things that parents need to understand is, yes, happy parenting doesn't mean you always make and keep your child happy. There are certain things which you need to put your foot down for your child to understand. It's not that you're going to beat your child, reprimand your child or other things, but you need to make your child do a certain things even if they don't like, because they need to do it. That's the right thing to do. It has to come from a very, very early age. It's a simple thing. I do have a lot of toys in my clinic, and there are kids who come inside the clinic, they will be playing with the toys for some time. When they leave, they throw a big tantrum to leave the toy and go. So many times the parents I can see like, leave it, I'll buy you a new one.
Oh.
I always tell them, don't tell them that. Tell them this toy belongs to Dr. Auntie.
Yes.
You can't take it. It is not
Yes.
your toy. Your toy is at home.
Yes.
We need to be very, very truthful to them.
Correct.
And it's most of the time, 80 to 90% of parents, it is always like, you leave it, there is one toy outside, or you leave it, I'm going to buy you a new toy. I ask them, are you going to buy him a new toy? Even then, it is spoiling the child.
Yes.
Like every place he is going to ask for a toy, and
Correct.
you can't keep buying toys
Correct.
for them. So it's very, very important. At early age, if the child is refusing to eat vegetables, it is always important to keep insisting, keep telling them, eat this. Unless it comes in the upbringing, it is not going to just one day I give one medicine, it is going to change. It is not, the child is not going to accept a not comfortable treatment if the child has not accepted the uncomfortable situations in life before.
Yes.
So there need to be always in parenting, Happy parenting doesn't mean you keep your child always happy. You do the right things for your
Yes.
child in the right way so that they can face this adverse world in the future. It's not about social quotient, emotional quotient, and intelligent quotient at all. In addition, there is also adversity quotient that the child has to go through. If there is no criticism at home, the child is not going to face not going to take criticism in a positive way in the
Right.
world. So do a mindful parenting. Don't aim at happy parenting always. You need to do things which your child may not like, and that may be the right thing for the child, which you need to explain. Obviously, you need to explain. Keep doing that repeatedly. Something which is done repeatedly, child is
Yes.
going to accept. And the no has to come from home.
Yes.
The child to accept no from outside. Otherwise, the child is going to just break down when there is lack of acceptance from friends, when there is a rejection in love,
Boundaries.
everything,
Yes.
the child is going to break down.
Correct.
So I just keep telling these things.
So, I mean, Dr. Vinod, when we talk about adults, I am pretty sure that most of the cardiac cases that come to you would be adults, maybe in their 40s to 60s, etc. Now, how does a very tough diagnosis, from your observation, a personal one, how does that diagnosis take a toll on their mental health?
So basically, when patients assume that when the first time when they come to me, they assume that it is a small problem, and I suspect a cardiac issue.
Yes.
So first thing they have to accept, where there will be a denial definitely. So how I put first time when I tell that there may be a problem, even though I know there is a strong problem is there, I will not directly tell the patient that you are having the problem.
Yes.
I'll tell them that there may be a problem, but majority of the people will not have the problem, even though there are symptoms, even though there are changes in the ECG. So, but better to go and see what is there inside,
Yes.
instead of assuming that nothing is there inside. So then I'll call the patient's son or whatever the attenders inside. I tell them that I'm suspecting a major issue. Please don't ignore. Just we need to do angiogram, whatever the necessary test to be done.
Yes.
And once the test is, I just tell the patient will be very much worried about how painful it is. Like instead of telling it will be less painful or not, like I just pinch them here. It's like that's it. I tell them
Yes.
your first procedure is over. You are going to come for the second procedure.
Yes.
So that pain will be very much less. I tell them this is how your pain is going to be. So I give them confidence that this procedure is not going to be painful, and I explain that you are going to talk to me throughout the procedure. You can talk to me. You can interact with me. That gives some confidence for them. Once procedure is done, probably I'll tell them there are small issues are there, we need to clear, we make them comfortable, but we explain the attenders very clearly what are the
Yes.
problems. Everything will be explained to the attender.
Okay.
For anxious patients, we tell them that this is a problem. So slowly, without even realizing, those patient will complete the treatment. And next part would be, I'll tell them that everything is clean now, but to avoid the second procedure, you need to take the medicines regularly. And some patients will be very adamant actually. They will tell that no, I don't want to. There was a patient actually who was a smoker who doesn't want to quit smoking, and he doesn't have sons. Only 3 daughters were there actually. So he was just, his son-in-law was there spending for him at that time. Insurance got rejected. So he was telling that no, it is very difficult for me to stop smoking and like that. So I understood his psychology. Then I told his son-in-law, just sir, actually he is finding difficult to smoke. If at all, if next attack happens, probably he might need more money. Please have a separate bank account on your father-in-law's name. Just keep some amount of money so that it will be helpful in case if any emergency occurs. He left that day. Next time when he came, he told that his son-in-law told that he's not smoking, sir, like that. I just told, sir, please tell me honestly. He said, no, sir, he's not smoking. I was shocked. 50 years of smoking. He started at the age of 6 or 7.
Right.
50 years of smoking. At the age of 60, 65, he came to me. I was really shocked. I asked him, why did you? No, sir, that day you told one thing, no? That you told my son-in-law to start an account for my treatment. In our customs are basically that we are dependent on sons. I don't have sons actually.
Oh.
I'm already eating in their house. I'm not working also. I felt very bad that day. I decided that I should never be a burden to my daughters. So I decided to quit smoking. I know that what is going to happen. I all predicted and I just told that whatever I wanted, I got it actually.
Wow.
But I just was shocked to see he came for World Heart Day.
Right.
I called him for a talk. For the youngsters who smoke 1 or 2 cigarettes for 1 to 2 years, finding difficult, I cannot stop.
Right.
I told them he's a 50-year smoker,
Yes.
senior to you, and he's advising. He says that in the talk he told that nowadays if somebody is smoking, I cannot tolerate the smell. I scold them, I blast them, I just go away. He came for the World Heart Day talk. I invited as a guest, and he has given a speech. Actually, it was a very wonderful moment actually. So how you tell to the patient, how you explain, ultimately the patient should follow the right thing.
Yes.
What best to the patient? Everybody needs a different way of treatment.
Yes.
Different way of telling.
Yes.
So I see the patient based on their education status, based on their understanding levels. So I put in a different. This was one interesting case because with smoking, unless he stops,
Correct.
very difficult
Correct.
for a 50-year-old smoker. Actually.
Absolutely.
So I got that point of that son is not there, only daughter is still there. So I just used that weapon to streamline that. So
Quite an amazing one, because I think the idea of giving a counseling, this is where the counseling becomes important, to actually find the patient receptive to the things that you're saying and want to actively participate in the things that you're recommending. Now, we're going to talk a little bit about, again, we spoke briefly about living in a digital age. A digital age means that both parents are working, they have access to the internet, and I can speak as a parent of a toddler myself. Sometimes we would kind of give a cell phone to the child to watch something while the mother is in the kitchen, while the father is doing something else. Do you think that this actually is a dangerous practice, Dr. Bharti? Does it have a long-term effect on children?
Absolutely. It does have a long-term effect on children. Even previously, when longer YouTube videos were used, most of the studies which we have talking about the effect of screen time on the child's mental health were all based on long videos only. We know even that was not right for the child. And with this era of short reels and shorts,
Correct.
where it is going to be just 50 seconds, 59 seconds of content, rapidly changing content, it is going to just create poppings in the child's brain.
Yes.
Fast connecting neuronal circuits. And this child, when he sits with the textbook or in the classroom where the teacher is going to monotonously talk with a single tone, and the book where there is black and white print with few pictures here and there, will not be able to focus for more than 5 to 10 minutes. In future, these kids who are watching reels and shorts, when they are going to grow up, this attention span is going to come down even further.
Correct.
It's very, very important. We ourselves would have noticed that on days when, see, someone who is regularly into focusing on what people talk, like a medical professional,
Yes.
my job is to listen to people talk. At times when I had watched a movie or I had watched something for a longer time, I had watched something on a longer time, I find the next day my focus is slipping.
Okay.
Even my screen time is very, very limited.
Right.
I hardly find where my phone is at home. With that, I find the difference because I always focus on where my focus is going to. That's why I'm aware of it.
Correct.
I find my focus is slipping. And for kids who are developing brain, when their screen time exceeds the limit, as well as when the screen time is of high energy content, where there are rapidly, you just take Cocomelon, there is so much of color and sounds and rapidly changing images in it. And the child who is watching that for hours together is going to wire their brain like
Correct.
that. The neuronal circuits are going to expect the same kind of stimulation even in a classroom, even when they are reading. They'll not be able to focus a storybook. So I always advise parents, while eating particularly, there are also studies that say food and water carries energy,
Yes.
right? So particularly while eating, it's very, very important to bond with the child, connect with the child, and feed the child till the age they cannot eat on their own. And after they start eating on their own, sit and eat without social media, without any screen time is very, very important, particularly eating time. But that is the time when most of the screen time
Correct.
is indulged in.
Correct.
So it's very, very important during screen time. Screen time has to be absolutely avoided during feeding. And the screen time has to be limited, and the content they watch should have very less stimulation, both auditory and visual, particularly visual stimulation.
Okay.
It's very, very important. Too much rapid changing colors, noise is going to wire their brain for less attention span and hyperactive behavior. Wow. That's definitely going to be there.
That's quite insightful, actually. But what would you say to parents, doctor, for parents who both parents are working? and when they are at home, the little time that they spend before they go to bed, they have to get things in order, right? So someone is in the kitchen, someone is putting the clothes for the next day together, someone is making sure the homework is done. When everyone is it's like an all hands on deck situation, and there is one child or two children that would be left unattended to while all these things are going on, what advice would you give to parents who feel like, I don't have a choice, I give them this so that they can sit and they can be safe, they don't get into mischief? What would you say to parents to say, there are alternatives that you can explore?
Yeah, I completely understand the fact that it is very difficult in the current day scenario. But in the process of organizing your house and organizing your professional career, we are disorganizing the kids.
Yes.
That understanding has to be there at least. Whether you're putting it into work or not is the next question. But you need to be aware of the fact, at least when you're aware, you will not be doing it in every feed time.
Yes.
There would be a major meal where you will have to. That is different. And second thing is, the screen is not the electronic babysitter. So it is our job, as I told you already, till 2 years of age, you need to commit that time to the child.
Yes.
Very important. Once you had committed that time and made the child the habit of eating without screen, post 2 years, the child is going to sit on the dining table and eat the
Yes.
food. That's not going to be a problem. But initial stages, once you had made that habit, it is very difficult to break the habit. It's absolutely difficult. So it should start right from the womb.
Yes.
The first 1,000 days, the womb 270 days, and the next 630 days after the baby come out is very, very important.
As you rightly said, when parents are working, you can engage the kids along with you in
Yes.
the work. So something in the kitchen they are working, you
Yes.
can give something to do some small work, so she'll be engaged with you.
Yes.
So so that we always think that kids don't know, so we are completely eliminating from their work. They can teach
Right.
some of those things. We can engage them with our routine activities like cleaning the house. You
Yes.
can tell them to do small
To teach
activities.
them to do chores.
Yeah, cleaning
Yes.
them. So they know how to clean, they know
Yes.
how to keep them, which we are not teaching
Correct.
nowadays.
Absolutely right.
So that is the best way to
Correct.
engage them in all our routine activities wherever
Absolutely.
possible.
I think that you both, the way you reason things out, it seems like there's quite a healthy balance between perspectives. I would just like to see maybe we could fast forward this eventually in the next few decades when your children grow to become successful, and we might be able to interview them and see what they are up to. Doctor, I feel like when we talk about, let's say, atherosclerosis, there are still many cases, both in India and internationally, where it's affecting children. And we have also seen that certain traumas and certain lifestyle habits that children have tend to affect them in their health later on in life, decades later. Now, how does your wife, being an expert in child health, how does her perspective, with a focus on psychology, she has that interest in it, how does that affect you as a doctor practicing cardiology, where you yourself would see patients carrying lifestyle issues that they would themselves have experienced as children affecting their health today?
Yeah. So basically, whenever I see a 60-year-old male,
Yeah.
usually previously 60-year-old male used to come, son used to take father. Nowadays it's not like that. Grandfather bringing grandson, father bringing son.
Yes.
If two people are coming, I'll be just thinking father is the patient, I'll tell them to sit, father will tell no, sir, I am fine with that, please take care of him. So things have changed nowadays.
Yes.
Because it is because of lack of physical activity, again poor dietary habits, online ordering whatever is available, sitting in one place, even midnight, 2 o'clock, whatever you want, you can get it.
Mm-hmm.
And even if you are not hungry, you just take something just to feed.
Yes.
And apart from that, social networking, smoking again. So these factors play a major role. And kids from the age of, as I said, the blocks in the heart start as a fatty streak from the age of 2 to 3.
Wow.
That's the thing. See, in Korean adults, they have seen that army people, whoever died, they've autopsied. 50% of them had blocks, and almost 70% of them had some block, and 20 to 30% had type blocks. So that 20 to 25 years of age. That means block develops at a younger age. There are two kids. One kid at the age of 2, 3, and slowly becomes 5, 10. That kid daily does good physical activity, eating only healthy habits, and going to college, non-smoking, that kid will have a very good lifestyle. The chances of blocks will be very, very minimal compared to a kid who is not doing any physical activity, watching mobile or online content and not doing any physical activity, and eating which is not necessary, and eating which is not good also, high saturated content. The overweight, the kid will be at the age of 10 to 12 overweight, at the age of 15 or 18 when they go to college, start some smoking habit. These kids are the one will have the problem like heart attack between the age of 20 to 30. My youngest case was 18-year-old guy who had a heart attack. We got two students from the same college, 18 and 20, same day heart attack actually, 2 hours gap actually.
And these are your youngest cases?
Yeah, 18 and 20.
Okay.
Mine was the youngest one actually. He was a smoker. They had a competition who smokes more cigarettes. They started a competition at 9 o'clock. And both of them had a heart attack. One guy came at a younger age, and parents were surprised, and everybody was talking like some heart attack is happening in younger kids without any reason. Only as a doctor, I know that he told me that this was the reason, because as a doctor, I am supposed to know what was the reason, how to come out of. So that guy had a lot of clots, and finally we were able to save the kid, but with a lot of damage to the heart. So this many people don't know. We think that COVID came because of that heart attack. Not like that. After COVID, lot of things have changed. Our dietary habit. We thought that if we eat more amount of non-vegetarian and more amount of red meat and other things, we can get more immunity to fight against COVID.
Yes.
That was the thought process. People started eating more. And we started getting online foods after COVID. After 2020, if you see, online before we never used to order food that frequently. Nowadays, you have a lot of apps are there. Online you order, midnight 2 o'clock you get food. The second one. Third one, everybody's work pattern has become like work from home. So most of the people are not going out. So no physical activity. All these factors played a major role in development of atherosclerosis, especially increased incidence of heart attack in the last 3-4 years because of these three major factors: lack of physical activity, poor dietary habits, and apart from that, smoking. All these things contribute to development of diabetes, development of hypertension, development of cholesterol, everything. Once you sit in one place, every problem starts. You increase your weight. Once weight increases, sugar comes, blood pressure comes, cholesterol comes, then finally heart attack comes. This is a spectrum of disease. So we should realize that we should educate our kids from the age of 5. The kids should follow reasonably good lifestyle, avoiding unhealthy food. If you inculcate that, see, when you're going outside, if you buy sweets and other junk food to the house and keep, everybody will have a tendency to eat. So mindfully, we should avoid bringing any unnecessary extra food, extra junk food to the house. If you don't buy, you will not find it in house. No, you have to go and buy again. So we should try to avoid bringing junk food, unnecessary food, unnecessarily, without any reason. When you go for birthday party, they give something, kids invariably will get junk food. Nowadays it's become routine, right? So why should we bring separately junk food and giving to them? So avoid bringing junk food to them and engage the kids in activities and let them play around. So these things will play a major role. So we are going to produce a next generation which is going to be healthy, means that it is in our hands. We have to take care of that part. We have a lot of responsibility as a parent. We have to concentrate on our kids between 5 to 15, their lifestyle, their physical activity, and the dietary pattern, which is going to create a next good generation. So we have to be very watchful and mindful about it.
Dr. Bharthi, have you ever felt, because again, the premise is that childhood trauma and childhood stress does impact long-term health, especially when it comes to heart health. So have you, in a personal capacity, felt like you needed inputs from Dr. Vinoth in a case that you're managing, just specifically so that the child doesn't suffer any long-term repercussions because of issues that they're facing?
Particularly emotional component. I have one particular patient whose mother is a patient of him, who was undergoing stent therapy for her heart blocks. And the child initially started with she coming for different somatic complaints, like stomach pain for a few days, and then which was not matching with the physical findings that I am seeing, and then headache, random headache and stuff. And then when I started inquiring, then the mother came out with a complaint like, no, I'm going through this. That is the reason why she is down, emotionally down and other things. Then I had in fact spoken to him about her mother's outcome and stuff. And the next time when they came, I could reassure the child, like, see, mama is getting better. She got the right treatment. She's going to be with you. She's going to be well. I could emotionally counsel the child. And yeah, the lot of kids whose parents, particularly nowadays, we are seeing a lot of young cancers in mothers, breast cancer, cervical cancer. And when the parents are going through the therapy, there is a lot of emotional turmoil that the child goes through. And they come to us mainly not for the emotional problems. They come to us with somatic complaints. Because of what they are going through inside their mind, they start complaining of bodily complaints, headache, tummy pain, this, that, those somatic complaints. When we analyze, when it is not matching with what we are finding clinically, that is when we go about and inquire. Yes, it takes a major toll on the emotional health of children, and of course on long term, as they grow up, the way they perceive health and the way they perceive the disease their parents have is going to be completely different. They are really scared of that particular disease. What if that comes to me? What if the same happens to my children? And this itself causes a lot of health problems also in them. Yes.
I think we had initially touched on how misinformation and the free access to information could kind of interfere with the appropriate treatment of a patient. So Dr. Bharathi, with concerns like things, let's say, for example, ADHD and so on, anxiety and depression, what kind of approach would you take or suggest that parents can take to treat their children with these kinds of disorders?
Yeah. Mostly with me in my practice, most of my patients, I start seeing them at a very young age. First time when they come to me for vaccination, when they are 6 weeks old. And those kind of regular patients, when they are following up, I do a developmental assessment at 6th month, 9th month, 1 year. I connect with them. I make sure the moment they come and sit, we don't start with the treatment directly. The moment they come and sit, it is always... I develop a rapport with the child. Do we want to break that sound?
Your phone. Sorry. Yeah.
Should I start from first? It's okay? Yeah. So, the moment the child comes and sits, I first try to develop a rapport with the child. That is when I do the major developmental assessment of the child. So, the connect they give, the eye contact they give, the appropriate answer they give when I ask the questions, the social connect they have with me, the awareness they have about the surroundings, whether they are socially awkward, whether they have that necessary inhibition to the new place or not, and what kind of behavior and what kind of response they are giving to their parents. So it just takes 1-2 minutes for that assessment. You see a child with the clinical experience you have, you will be able to assess whether this child is in the normalcy or is deviating from normalcy. That is the right time to catch hold. Tell the parents that, are you also finding these problems? Many times it will be denial. It'll be first time, mostly it'll be denial from the parents. No, he's fine. He's just little overactive. There are some parents who are overtly worried about a normal child, that no, madam, he is not like this. He is not answering colors now when the child is just 1.5 years old. Then I tell them, like, what is normal? What is the cutoff for this age? Is your child doing this? So your child is fine. You can wait. So there are some parents who are like, yes, I also find this problem with him. So that where the parent also is finding the problem and I am also finding it is very easy. We just start the therapies, whatever needed, further assessment and stuff. When the parent is in denial, I'll not immediately go jump in advice therapies. What I first tell them is, keep observing for these symptoms. These are red flag signs. Keep observing for these symptoms. I give them the time. I give them a month or 3 months time, because therapies are very, very important to be started at the right time. Developing brain, by 2 years, under 2 years, most therapies need to be started. And under 4 years, almost all therapies need to be started. Post 7 years, we have very, very less outcome, because all the axonal connections, the synaptic formation is completed by that time. After that, it is always pruning. You let go of the already formed habits and connections, and forming new habits is going to be very difficult. It's very easy, right? It's like break a habit and form new habit is much difficult. And forming a habit as you keep growing, that's easier. So catch hold of them earlier, with the subtle signs and symptoms. But if the child is coming to me for the first time when he is 4 years old, 5 years old, and I'm finding there is some abnormality, and we discuss with the parents, and then we start the therapies, it's different, but it's very difficult. That's why it's very important to be followed up on a regular interval in the first 2 years of in fact, our immunizations are all planned that way only: 6 weeks, 10 weeks, 14 weeks, 6th month, 9th month, 1 year, 15 months, 18 months. The immunization here chart is itself is planned like that.
Okay.
So it's very important you go for a consultation during the immunization time, so that your doctor can assess these things.
Right.
In fact, I find some patients asking, like, for immunization, do we need to see the doctor? The nurse can give the vaccine, no. But like, it's very important. Those are the times where we pick up these developmental
Yes.
abnormalities, the growth flatterings, and all these things. Those are the times we pick up. So the first 2 years, during your vaccination time, please make sure your doctor is seeing the child, and these things are assessed. That's very, very important. That's when we catch hold of all these deviations from normalcies. I wouldn't call them abnormalities.
Yes.
Usually they start deviating. That's
Yes.
when you catch hold of the child and do this.
Thank you, doctor. The grandmothers in the home tend to have their traditional methods of treating kids. So, with you coming with a more, with a more conventional medical management of children and how to treat with them, how do you earn the trust of somebody who would more likely want to gravitate towards a very traditional means that now we have seen science debunk some of those things? How do you earn trust in such a case, doctor?
Yeah. So mostly this I observe particularly with newborns.
Yes.
And post newborn stage, it's always when it comes to eating habits. Other things, mostly parents have the control, whereas when it comes to eating habits and newborn practices, the grandparents have a great control on parents. One reason being, these are new couple, new parents. They don't have much understanding of what they are doing right, and they also need the support of their parents.
Correct.
For the child's upbringing and other things. First thing, during the first visit, I first analyze and see who is the major influencer in the child's rearing. So the next time, I make sure that person comes for the clinical visit.
Right.
Say, for example, if the mother is saying, "Madam, I want to not give this, but my mother-in-law or my mother says, no,
Yes.
you have to do this." I tell them the next time, bring the mother or mother-in-law, because
Right.
there's no point in this mother going and conveying what I say.
Correct.
There's always I am going to create a family problem instead of treating the child. So I always ask them to bring the person during the next visit and try to convince them in largely.
Yes.
Okay, by giving, of course, the scientific evidences and other things. But there are certain practices which will not be very harmful. I tell the mothers to just leave it like that, because more than creating a family problem, these simple practices which are not going to harm the child, just let them continue. But there are some practices which are going to really harm the child. We do explain them. And if still the elders at home are not going to listen to that, I tell the mother one simple thing: just listen. Tell them, yes, I am doing it, but don't do it.
Correct.
It's as simple as that.
Medical care in general as an industry in Hyderabad, there's still quite a long way to go in terms of it being more accessible, in terms of it being more ethical across the board. So, Dr. Vinoth and Dr. Bharthi, which one of you wants to take this question? Because I just wanted to find out, what do you feel could work to make healthcare accessibility better in Hyderabad? And what do you feel your clinic has to offer that really bridges that gap, or makes, or be a part of that movement towards making healthcare more accessible?
See, basically, my vision is like, we have to prevent the heart diseases. That is my priority. That is in my mind all the time. So my mind will be working towards that. My every patient who enters to me, even the father comes to me for treatment, I just look at the son. If he's overweight, I tell him, at the end, please take care of your body weight. So the entire spectrum, like it is, I see next 20 years how he will be. I always will think about the next 10 years, how my patient is going to be, 10 to 20 years, how he should be, means what he is supposed to do today. I just give a list. So the prevention is the most important thing, where we can save so many people lives than doing interventions. because in interventions already the patient, so most of the heart attack happened between the age of 30 to 50, where that time if something happens, the entire family, not only emotional disturbances, financial disturbance, lot of things are involved, because the entire family, both parental side, kids, everybody will be dependent on that person between the age of 30 to 50. That is the most crucial part of our life, where many people are dependent on both emotionally, financially. So that part I just have to, I will be very careful about it. So I take my patients even at the age of, from the age of 20, I educate them just to check their sugars, cholesterol levels, blood pressure once in a year, and do physical activity. So I just want my clinic to see like as if it's a place where if I go, at least I reduce my chance of developing heart problem. And if at all, if I have something, at least I can prevent a heart attack. That sort of thought process should come to the patient. I am working towards that. My mind is longing for that, like preventing heart disease, so that we can reduce the burden to the family, both financially and emotionally.
What about you, Dr. Bharti?
Yeah. So I always like how he said his patients next 10-15 years later, but my patients are the ones who are going to be the main pillar of future world. So I always look at the kids. Of course, we treat their infectious diseases and other things. And always I also look at how this child is growing up to be a responsible adult, healthy adult. So my advice to most patients will always be towards that only. So for their future and other things. And one main thing that I keep in my mind is when my patient leaves my clinic, the parents, even if they come for some sickness or routine vaccination or whatever, when they leave the clinic, when they leave my chamber, I should leave a smile on their face.
Yes.
Okay.
That's a wonderful thought. I just wanted to find out, with both of you being seasoned doctors, would there be any advice that you would like to give to the young aspiring doctors who would be viewing this, wondering, thinking to themselves, one day I want to sit there, I want to do this, I want to be a doctor, I want to be able to make that kind of difference in somebody's life. Would there be any kind of advice that you would like to share?
Yeah, our generation was completely different. As we told you initially, we didn't aspire to become doctors,
Yes.
but once we enter that field, we loved it and we are
Yes.
doing it with great commitment now. But kids of this generation are completely different.
Correct.
They are not the type of people who will be doing something just for the heck of doing it. Unless they love it, unless they are really finding the joy from the job, they'll not continue to do that. That's the general mentality of kids of this generation. They have very good awareness of how this medical profession works. Nowadays we have this young doctors program by different
Yes.
hospitals, and they also do some internship when they are in their 11th grade, 12th grade itself. So they can get the taste of this profession very easily nowadays. And once they really love the job, if they really think that this job is going to give them the happiness and the satisfaction every day as they go forward, and they think they are committed to make a change in people's life, if they feel so, it's a wonderful job to take.
Yeah. So, would you have any particular advice that you would like to share to someone who is contemplating whether they should study medicine?
Yeah. Contemplating to study medicine, there could be two reasons, right? One is whether you want to be a doctor to make an impact on people's lives and to find joy in that profession every day, or you think that's the profession where you can make money or things
Yes.
like that. It depends upon your intention, why you want to do.
Correct.
So if your intention is that you feel this job is going to give you joy every single day, and if you feel you can make impact on people's lives, and you will be happy throughout doing this job every single day, that is when you should take up
Okay.
this profession. And as we know, our generation, we took up things, we committed ourselves to it, and we started loving the profession. Of course, this profession is very lovable, and we fell in love with that profession, and we continued doing this. But this present generation kids, they have their own set priorities.
Yes.
Unless they feel this is giving them happiness, they'll not continue to do that. They'll not be very committed to do that. So nowadays, there are a lot of scopes, there are a lot of programs where kids can attend, get a taste of this profession even before they choose it. And once they feel it is right for them, they can take it. It's a wonderful job. Every single day, you will find something different. You meet people who are so different. Sometimes I'll be so astonished by certain things and the way kids react, certain things. I'll be so taken aback. Even after this many years, there are kids who surprise me every single day. And I get beautiful, cards from these kids who are wonderfully made. I paste all of them in the wall. And every day I look at that, it gives me so much of happiness. The job definitely gives a lot of happiness every single day, and you make impact on people's lives every single day. And it's something new to look forward to every single day. But provided you want these things in your life.
Yes.
Provided you want to do these things every single day. And once taken, there's no looking back. It's a wonderful job.
Absolutely. I think listening to Dr. Vinoth and Dr. Bharthi talk, I feel so reassured for the field of medicine in Hyderabad. I feel so reassured that the health of so many people are in excellent hands, to be quite honest. You've really spoke about your professions in a manner that sort of mixes the science with a bit of art, with a bit of personality as well, which is a wonderful thing to behold. And in a sort of an industry where the focus is usually more on OP to IP conversions rather than patient outcomes, it's refreshing to hear so much of focus and emphasis on making sure that the patient remains at the forefront of every consideration. This was a beautiful conversation. I thank you so much for joining us.
Thank you so much.
Ladies and gentlemen, I want to also thank you so much for staying tuned with us, for listening on this wonderful conversation and taking something home back with you. I would also like to encourage you, if you want to learn more about Dr. Vinoth, about Dr. Bharthi, I'll be sharing descriptions about them and their clinic in the description below. Please don't forget to like us, to subscribe and follow us on social media on all of the different handles. I'm selfishly asking of this. Please make sure to follow us. The benchmark that we set from episode 1, let's try to break it and let's try to keep moving upwards. I thank you so much for joining us. This was Juve Talks. Satish Raghu signing off. See you again in another episode. Thank you.